Hi everyone, welcome back to my channel, and in this video I will tell you about antiphospholipid syndrome. What is APS, antiphospholipid syndrome? Antiphospholipid syndrome is basically because of an antibodies known as antiphospholipid antibodies. This is known as APA, antiphospholipid antibodies. Now these antibodies are autoimmune, that is, it is produced by our immune system, and these antibodies, autoimmune antibodies, antiphospholipid antibodies, attack the phospholipid that is there on the cell membrane, or the proteins that is bound on the cell membrane. On the right side picture you can see the phospholipid, the phospholipid, which are the integral part of the cell membrane. And whenever these antibodies, antiphospholipid antibodies, are produced, they attack the phospholipid that is bound on the cell membrane. Now this antiphospholipid syndrome or APS can be of two types. One is primary, another is secondary. Primary occurs by itself, that is, it occurs by its own, and secondary occurs with other autoimmune diseases. You can understand, along with SLE, systemic lupus erythematosus, it can occur. This is more common in young females. Always remember, young females are having more common. And another is the cause of APS isn't known. We don't know the cause, but generally it is thought that genetic and environmental factor can cause APS. Now look at this picture. You can see the antiphospholipid syndrome, how it is occurring inside our body. Basically, you can see on the top there is APL antibody, that is antiphospholipid antibody. These are the Y-shaped antibodies which are produced by our immune system, and these antibodies, you can see, it goes to the blood vessels and it creates clot, it creates thrombus in different portion of our body. Suppose it produces a clot in the thigh, inside the deep vein of the thigh, and it produces deep vein thrombosis in the leg. You can see on the right side picture, the person is showing the deep vein thrombosis, DVT, on the right side, right leg. And this thrombus can also go and clot the arteries of the heart, and it can also produce MI. So you can understand, infarction of the heart tissue can occur. Along with that, these can also go and block the vessels of the brain, and it can produce stroke. You can see the three organs mainly it can produce damage. One is brain, another is heart, another is the DVT. Always remember, there are complications of this disease. So what are the complications of this disease? If you are having APL, antiphospholipid, for a long period of time, you may develop several complications. Number one is kidney failure. This is very important. Like, if the blood flow of the kidney is compromised, it can produce kidney failure. Another is stroke. I told you that if any portion of the blood vessel which is supplying the brain that gets the clot or the embolus, then what happens? The brain will be having ischemic stroke, or the the blood cannot reach there, and that is why it can get stroke. Another is the cardiovascular problem, a blood clot that is there inside your leg that can also lodge inside your heart. So it can travel. Basically, you know that the thrombus is a clot that has a fixed position, but when it travels, it is known as embolus, and it can be lodged into the cardiovascular system. Along with that, you can have lung problems. Basically, what happens, this can include high blood pressure in your lungs, and it can also cause pulmonary embolism. So all these can be caused. Another is the pregnancy complication. This is very, very important. Pregnancy complication is very important for this disease. Basically, what happens, this cause miscarriage, this cause stillbirth, and also premature delivery. All this, slow fetal growth, and dangerous high blood pressure in the females, in pregnant females, that is known as preeclampsias. So all these are complications: kidney failure, stroke, cardiovascular problems like MI, and lung problems like pulmonary embolism, and pregnancy complication like preeclampsia. Now look at this picture. You can see what are the process, or what are the things that can be caused by antiphospholipid antibodies. Number one, it produces a hypercoagulable state. So it will be increasing the coagulability of the blood. Always remember, number one on the left side top. Second, and this hypercoagulable state can produce thrombosis. You know thrombosis, the blood clot in the arteries, in the veins. So what happens when it causes arterial thrombosis? You can see the left side, arterial thrombosis. Arterial thrombosis generally common in the males, and this can cause and lodge in the heart, and it can produce heart attack, it can cause stroke, it can cause limb ischemia. All these are arterial thrombosis. And another very important disease along with the arterial thrombosis, that is known as Liebman-Sack endocarditis. This is very important. Liebman-Sack endocarditis. Endocarditis basically means inflammation of the endocardium. Basically what happens, vegetations, that is a mixture of the immune cells and the blood clots. So what is vegetation? A immune cells and the blood clot mixture that developed inside the endocardium, and that is known as Liebman-Sack endocarditis, and this produces inflammation of the endocardium, that is known as Liebman-Sack endocarditis. This can be caused due to the arterial thrombosis, and usually in the Liebman-Sack endocarditis the mitral valve is involved. Another is the venous thrombosis. You must understand what happens. Venous thrombosis is first of all, venous thrombosis is more common in the females. Why more common in the females? Basically the females, when they become pregnant, they develop DVT, because for a long period of time they need to remain immobile, because they have a huge belly and they have to sit down for a long period of time, and because of that they develop DVT, deep vein thrombosis. So basically what happens, a pregnant females had to stay longer for a long period of time. They need to sit with their huge belly, and because of their immobility they develop venous thrombosis in the deep vein of the leg. And this thrombus, when it comes out from that portion and it moves, that is known as embolus, and it can be lodged in the lungs, and that is known as pulmonary embolism, and this can produce a symptom of SOB, that is shortness of breath. Basically what happens, this thrombus, it comes out from their original DVT location, and it moves here and there, and it goes and lodge in the lungs, and this produce emergency condition, life-threatening condition, because it blocks the blood that is getting from getting oxygenated. So the blood cannot get properly oxygenated in certain portion of the lungs. That is a serious condition, that is pulmonary embolism. You can see on the right side of the picture the lungs is shown and pulmonary embolism is shown. That means a clot is formed inside that. There are various risk factors which are associated with this disease. You can see the bullet marks. Number one, becoming pregnant. Number two, becoming immobile for a long period of time, sitting in a long flight. Maybe having surgery can produce this. And also smoking cigarette is a risk factor. Also, if you take OCP, oral contraceptive, estrogen therapy for menopause, and if you have high cholesterol and triglyceride level, this can also produce this. So basically what are the symptoms you can get in this disease? Number one, I told you DVT, that is deep vein thrombosis. You get swollen, red, painful legs, where later it can also produce pulmonary embolism, which is shortness of breath, and it is emergency. Next is miscarriage or stillbirth. If you are pregnant and if you are having high blood pressure, preeclampsia, premature delivery, miscarriage, stillbirth for a long period of time, it can be. And if you are having stroke, that can also be produced due to antiphospholipid syndrome. And if you are having TIA, that is transient ischemic attack, which is similar to stroke, and that only lasts for a few minutes, and it causes no permanent damage, that is TIA, transient ischemic attack, that is also a symptom. Another is rash. Some people also develop rash which are net-like pattern. Other features you need to understand, like if you are having emergency conditions like stroke, you need to visit the emergency. If you are having pulmonary embolism, chest pain, coughing up blood from the mucus, you need to visit emergency. And if you are having deep vein thrombosis, that is the signs of DVT like swelling, redness, pain in the leg or arm, you need to visit the emergency. All these are emergency. From there you may go and check up in the medicine department, and they can understand or diagnose your condition if it is antiphospholipid syndrome. Thank you so much for watching till this. Thank you so much. Please subscribe this channel if you are new to the channel. We have many videos on different medical conditions. If you are a medical student, if you are a MBBS student, if you are a BSc nursing student, if you are a GNM nursing, A&M nursing students, if you are a PT student, physiotherapy student, if you are lab technician, whatever you are, if you are related with the healthcare system, if you are a healthcare staff, if you are a blood staff, from any portion of the hospital, if you are engaged as a worker, please subscribe this channel. Please subscribe this channel. This channel has a lot of free content. All the contents are free. Thousands of videos on different medical condition. You can learn, you can understand. Thank you so much for watching this video. Have a nice day. Bye bye.